When patients approach you and they want to get off of the psychotropic drugs, how do you treat them? What kind of symptoms are they going to be dealing with? How do you treat them nutritionally?
Yeah, well, I go through the same psych evaluation basically to find out more about their background and how long the meds they've been on, what they took 10 years ago may be affecting them now, what the dosages were, et cetera. And oftentimes they don't remember. Some people come in and they've been on 30 different psych meds, for over the last 10 or 20 years. And where do you start? I mean, it's just very difficult. But so I get that basic history.
So they're not who they used to be.
They're different now, right? Yeah, that's right. And their brain is altered in some way that we can't really put our finger on. There's no brain, you don't do brain biopsies in humans like you do in the rat lab.
Right.
So we don't know for sure what's going on with their brains. We're just assuming that if they would do better without the meds and on good nutrition. So I try to devise then a proposed therapy where we choose one or two of the drugs, and it's really complicated if they're on 4 or 5 or 6. If there's only on one, then we know the first one to start withdrawing. But sometimes people are on drugs that oppose each other. There's a psychostimulant and then there's a depressant. Well, maybe you can withdraw both of those at the same time because one's causing the symptoms that the other is masking. So sometimes you can cut down 2 at the same time. Some drugs like, Lipitor you can quit cold turkey, and even though it does have brain effects, it's not like an addicting neurotransmitter medication. So some people, you can quit cold turkey on some things, and others you have to taper down. So each patient is individualized. There's no 2 patients alike in the world. They either started them at different age or they took different doses for different lengths of time. So there's no 2 patients that are exactly alike. I've never seen 2 that are even similar. So each one has to be assessed as individuals. And so it's flying by the seat of your pants sometimes, but and the patient knows, I got to get off this stuff and as fast as I can, but I always warn them, don't go too fast. And so I say, if you're having tolerable withdrawal symptoms, that's normal. You're going to have to go through some pain. If they're intolerable, then we're going too fast.
And some of those symptoms would be things like sleeplessness.
If you're on a tranquilizer medication, insomnia is a huge one. So you really got to work hard at doing non-pharmaceutical approaches that help with sleep at the same time as you're helping withdraw from the meds.
And irritability.
Oh, yeah, there's a list. I have handouts that I give my patients of dozens
of the symptoms
that they may expect. Right. In the book, The Antidepressant Solution by Joseph Glenn Mullen, wrote a book, The Prozac Backlash, and he wrote a follow-up book that I don't have right here called The Antidepressant Solution, which is a guide to withdrawing from antidepressant drugs. And each drug has a little different duration of action, so you can go faster on some than on others.
Oh, all right.
And usually when I get the patients on their brain nutrient supplements, it makes the withdrawal symptoms much more easy to go through. Some people have no withdrawal symptoms when they're on the proper brain nutrients for a length of time. So that really is critically important in my practice to do brain nutrient supplements in addition to
those again are the EFAs?
Yeah, essential fatty acids, the various amino acids, tryptophan. For the selective serotonin, the SSRIs, you need to replenish tryptophan or 5-HTP to replenish the serotonin. And that requires vitamin B6 and folic acid and vitamin C and magnesium and zinc and a bunch of vitamins as well for that metabolic process to convert the amino acid tryptophan into the brain neurotransmitter serotonin. So it isn't as simple as just, well, here, take this amino acid. You got to have more than just that. So it's complex and it's time consuming and you have to follow the patient carefully. So people that don't have insurance are kind of behind the 8 ball. They can't afford to come in every week or 2 like they should. People with insurance good insurance are my best patients because they don't have to worry about the economics of that. My advice to everybody is don't get on them in the first place. Try every safe alternative you can, which would be the same things I use in support of their withdrawal, and good psychotherapy and understanding where they came from, so they realize a drug is not going to help losing custody of the kids or job stress or whatever. They need to deal with that with good counseling and their own way of coping with the stresses in their lives, and then making sure that they're eating right and not eating toxic food. Getting good sleep is critically important. Poor sleep makes everything worse. And so we need to deal with that. And there are a bunch of nutritional supplements that are very supportive of good sleep quality.
Okay, thank you so much.
You're welcome.